Welcome, everybody. We are recording this meeting to send out afterward our Lunch and Learn. It is with great pleasure that I get to introduce Dr. Katelyn Parsons. Dr. Parsons obtained her PharmD from the University of Connecticut and completed a PGY1 residency at the VA Boston Healthcare System. She is a board-certified ambulatory care pharmacist and clinical associate professor here at Western New England. She runs a diabetes service at Baystate Longmeadow Primary Care here in Longmeadow, Mass, where she takes APPE students. She teaches in several therapeutics courses and applied pharmacy care labs at Western New England. And her research interests include diabetes distress and APPE readiness. Okay, so without further ado, Dr. Parsons, take it away.
Awesome. Well, thank you for those that are joining us today. I know that in some places they have the benefit of this being a holiday where we're here working. But for those of you that aren't here now but are watching later, hopefully that you find this somewhat helpful. I've been a faculty member for over 10 years at Western New England. I joined in 2013. And so today I'm going to talk about some of the tools and techniques of things that I do to set the expectations from day one with my APPE students, these things that I've been doing for over 10 years. And I continue to hear feedback from the students, how helpful it is that you set the stage from day one. They know what to expect, and that really makes the rotation usually go much better. So I'm going to break this down into a few different parts. First, I'm going to talk about a learning contract, which I use to supplement the syllabus that the students get. And so on most of the required rotations, so ambulatory care, community, institutional, acute care, the syllabus is from the experiential office, right? So we have our defined objectives, and that is the technical syllabus for the course. And so my rotation is an ambulatory care one, and to supplement the syllabus, I use a learning contract. I'll show you what that looks like and what I include in just a couple minutes. So we'll talk about that first. And then I'll show you how I make a calendar for the students. It's always tentative what I anticipate the rotation is going to look like, but I detail what each day is what I expect it will be. And certainly things can change, but at least they know where they have to be when, what kind of things are coming up for the whole rotation. And then the last thing I'm going to show you is I make, so at Western New England, we have this course website we can make for our rotations. And so I have a course Kodiak page where I upload a lot of documents for the students. If you don't have the ability to do that, you could do something similar with like a Teams or a folder, a share folder that the students could access. But I'll kind of walk you through those three different things. We'll open it up for discussion and questions. If you have any questions throughout, please feel free to chime in. But first thing, I'm going to share my screen and kind of show you this learning contract here. So when we first started getting APPE students, the very first year of the program, and like I said, the syllabus is generally the standard syllabus from the Office of Experiential. A lot of us faculty felt I need something that has information for my practice site. So I made this learning contract, and I think a lot of the faculty have followed, and you may find something like this can help supplement the syllabus. It's just a 4-page document, but it has everything, like the key things that I think they need to know about the site, what I expect for their assignments, and kind of the day-to-day at the site. I have my contact information here, what the schedule in general will look like, and I always tell them these are the max hours I expect you to be available. Some days we may start later or end early, you may have project time, but these are the times you need to be available, and kind of usually what the schedule looks like. This next section is all of my expectations and what they should be responsible for. So in writing, they understand this is what I expect of them. You might think that some of these are like common sense, they should know that, but by going over this on day one and having it in writing, it is very clear. And I have them sign this learning contract on day one. You'll see that at the end. So we've gone over it. You know what I expect. There's no question. But simple things like arriving on time, how they treat the people at the site. The third bullet here, the way I run my rotation is the first 1 or 2 weeks, I am leading the visits, the clinic visits, and then the middle couple weeks, they start interviewing the patient, and then at the end, they're hopefully running most of the visit. But I'm kind of detailing how I plan to run the rotation and how they can expect to be involved. I expect they'll work up the patients before each visit, so they should be prepared to answer any questions about their disease states, their drug therapies, any problems that there might be, drug interactions, and we'll have a discussion of each patient before we see them. So they should be prepared for each of those discussions and what changes they think the patient may need for their drug therapy prior to the visit. In writing, I write that they cannot give recommendations to patients or other members of our healthcare team unless they've discussed that with me. The only exception is if it's a simple drug info question that they can easily confirm in a database. They can answer that question and then run it by me later, but more detailed things or patient-specific recommendations, they cannot answer that without running it by me. I talked briefly about the HIPAA policies. Any notes that they write or education handouts that they want to use must all go through me first. When they have project time, where can they work? And so usually I say they can work at home if they'll be productive, but they need to kind of let me know where they're going to be. You'll see when I show you my calendar that we have different topic discussions, and so they should be prepared for those. And I'll show you on my Kodiak page later that I upload documents, guidelines, things they should use to prepare for those. I specifically say how all assignments need to be turned in by the deadlines, and unless they talk about it with me prior, but that missing those deadlines can result in failure of the rotation. This is a big one that I expect them to use high quality references whenever they're making recommendations. So they shouldn't be saying Dr. Madison said, they should be saying the ADA guidelines, recommend this, and using evidence to support their recommendations. I also ask that if there's something they want to get out of the rotation that they're not, that they let me know. I want to work with them to meet their goals. I ask them in the first couple of days to send me at least 3 goals for the rotation. But as it's going, if they want to get something out of it that they're not, I ask them to let me know so we can work together and it can be the best experience for them as well. I probably shouldn't talk about this bullet, but so my way to reward the students is that if they've done everything as I expect, they've been professional, they arrive on time, they meet all the deadlines, I generally will give them the last day of the rotation off. Because we can't reward them with letter grades, it's pass fail. But I know that they've worked more than the 40 hours throughout my rotation the whole time. So they've definitely put in their hours, and that's a way I can just reward them for being awesome. And some of the blocks now, the students do have a mock NAPLEX on the last day of the block. So those students don't get the same benefit, but other blocks, I try to reward the students with that. The next section, I detail all the assignments that I'm actually going to grade. There might be other things that come out during the block, things that I have them do for our practice site, but just specifying what are the 3 oral assignments that I'm going to grade, what I expect for those, and then the 2 written assignments, kind of what it should be like, recognizing that other things may come up, but this is what I'm going to grade them on. And I'll show you later when I show you my Kodiak page, I have all the rubrics uploaded there. And then I also have at least 2 examples of each of these assignments from former students. So they can, again, see what I expect and they can better meet my expectations with these assignments. The next section is just kind of standard things of like, I expect that all their work to be their own work, and then different policies related to our site. So internet use, phone use, about their badges, how they should present with their dress code. What if we have hazardous weather? What if you need an absence? So I just supplement some of the things that are in the syllabus with more site-specific things that I expect from them at my practice site. With COVID, the students had to sometimes buy like protective eyewear. So I have that in there that they may have to purchase those things depending on, the status at the time. And then the last page just talks about like grading, that the rotation is going to be pass fail, but they also need to meet expectations for all the assignments and all the professionalism criteria. To supplement this, I also print out their actual evaluation sheet so that they can see everything I'm going to grade them on. And I give that to them on the first day as well. The students should know that I'm going to give them feedback the whole time. So every time we're in clinic, we go over how they did with the patients, and then they get more formal feedback at the midpoint in the final. But before I do those evals, I have the students self-evaluate. How are you doing? What's going well? What could go better? And so they know that's going to be coming. And then the last part of this is just acknowledging I've reviewed this. I know what the expectations are, how I will be assessed, and that they agree to comply with the site-specific policies, and that all patient info is confidential. And they sign it, I sign it, ask if they have questions. But this helps me to tailor things to my rotation because the syllabus is so broad. This is my supplement, what I expect from the students. Are there any questions at this point about the contract, kind of what I have in there or how I use it? Any questions from anyone on here?
Give them time to read that like on the first day, or it's something you sent ahead of time. When are they reading all that?
So we actually go through it. That is like part of the orientation for my rotation is we go through each part of it to make sure they understand. But then they get to take home the hard copy, and then also an electronic copy is uploaded on my Kodiak page so they can refer to that at any point later as well. But I think it's worth spending the time to go over it. I think just sending it ahead of time, they may not actually look at it, but here I can stress these things and make sure we're on the same page. I do think it's worth that dedicated time. It goes quickly, but to set aside a little time to set the expectations in the beginning, I think saves a lot of time later.
I'll also just chime in for those who aren't as familiar with Western New England. Kodiak is our learning management system. So that's how the students regularly access their courses. So it's equivalent to say like a Canvas or a Blackboard or whatever else that you're accustomed to using.
Awesome. Thanks, Dom. I'll show you what it looks like later so it makes a little more sense. So the second thing I'm going to show you is just a calendar, example calendar I would give a student. This is from the last student I had. I don't have any right now, but I actually just recently started at my practice site in January. So she was the first one to have a rotation here with me at this current site. But our schedule changes. Sometimes we're at the site, sometimes we're at Western New England, sometimes they're shadowing with different people. And so I spell it all out. I know some people color code, make it all pretty, whatever you want. But I think from day one, the student generally knows where they're going to be, what's going to be expected, realizing that things might change and you can update them as those changes do happen. Some things you may not have all the times worked out, and that's okay. But giving the students something from the beginning to better know what the rotation is going to look like, what to expect, I think really reduces a lot of their stress or like not knowing what's happening. Here, they can better anticipate what's coming. For all the assignments, I bold things that are actually due, when they're due, so they can plan out throughout the block and balance their time. A lot of the faculty also will use something like this. I know, Dr. Madison, you said you used to color code yours. So there's lots of variations of this, but the students really enjoy this. And it's kind of surprising to me when I have students who, they're coming to me for their first faculty rotation and they're like, I haven't gotten any calendars. Like, this is the first time I'm seeing this. This little thing, putting in as much as you can ahead of time, really helps the students to know what to expect, enjoy the rotation. And you can reuse it, right? Just modify with whatever comes up for the next block. Any questions on that while I'm transitioning to the Kodiak site? And, if you don't have all 6 weeks planned out ahead of time, I think that's fine too. If you can do it in 2-week chunks, whatever you can give the students so that they can just plan and be kind of forward thinking, really helps them a lot. All right. So the last thing I'm going to share here is my course page. And like I said, you may not have access to something like this, but a shared drive, anything where you can put documents and share them with the students can serve this same purpose. But this eliminates all the, I need to email you all these files and What I tell the students is use it as much as you want. There's a lot in here. Don't get overwhelmed. It's just one place I can put everything, and you use what you find helpful. So that learning contract that I showed you, that's in here. The next folder is different resources that may help them when they're here at the clinic. So how to work up a patient, different templates we might need for notes, the HIPAA policy. We do some activities about motivational interviewing, and I'll give them an assigned reading from here at some point in the first week. And so just different things they might need for working more at the clinics in this folder. The next folder, I have all the rubrics that I use for the graded assignments, so they know how exactly they're going to be graded, what the weighting of different things looks like for those assignments. And I know that in RX Preceptor, I think some of these rubrics are uploaded that preceptors can use if you need a rubric. I think a lot of those are already in RX Preceptor for you to use if you find helpful. And then what I also have in this folder is examples of different students' work. So the students know exactly what I'm looking for. These are students who did very well. And the students can then kind of mirror their assignment like these. It just helps to more clearly convey my expectations by seeing examples. And then the next folders are focused on our topic discussions. We generally have at least 4, but often more, but each main topic discussion has a folder with guidelines and different resources that I think they might find helpful. I update these periodically when new guidelines and things come up. But again, it's a place I can just have all these files, use whatever you want. I don't expect you're going to read all these trials, but we're likely going to talk about many of them in our topic discussion. But definitely they should be looking at the guidelines and being prepared for those discussions ahead of time. So I think that kind of sums up these are the 3 things that I do in the very beginning to set the expectations for the students: the learning contract, the schedule, and having this course website or a share folder where all these files are accessible. It definitely reduces your workload later. Students better understand what to expect throughout the rotation. So I guess for any of the preceptors maybe who are on the call, are there any tools or things that you guys that you use during your rotation to clearly set expectations in week 1? Dr. Madison, anything you want to chime in on?
Yeah, I was thinking that even if somebody wanted to try, maybe they already have one of these things going and they just want to try one thing right off the bat, that would be really, doable. The other thing I think I did one time, I had a student create the calendar and fill in as well as study for NAPLEX. Like I had them chunk out because it was maybe a student who would be struggling. So had them make it. And so then they could, I didn't have to do it. And then they were building in things that were of interest and health fairs that we had and stuff. So if students sometimes have some pretty good skills with all of this, so, they could start to design that calendar for you, and then you could reuse it down the road.
I know here at Baystate, so the people who coordinate the experiential rotation send us this whole long thing of what we're supposed to go through in orientation. And yes, we go over those things, but I think having in writing the most important things helps the students to focus on the expectations. Just hearing things verbally, a lot of times it doesn't process. So I think that learning contract really helps to solidify the most important things that I expect and kind of focus our initial discussion a bit. But I've continued to get positive feedback on these things. They seem like common sense things. They really don't take a lot of time. Once you have it, you just update it, reuse it. And so it can be really quick once you have these initial tools set up. But the students greatly appreciate these kinds of tools.
Even if your contract isn't already in our resources, would it be okay to put that in there so people can look at that after this meeting? Okay.
Yeah, I don't think that is in there, but I can, yeah.
Okay. That would be great. I'd help people get a template down. Thank you. Yeah. Anybody else have any questions or want to share what you do, or what's worked well for you in the past? Okay.
It's a holiday, right? Everyone's
Is-
on holiday mode.
Well, if you have any questions, you can certainly reach out to anybody in our office. We'll put you in touch with Katelyn Parsons, and any resources you might need that you've seen today, you could have and or talk about an idea. That'd be great. Thank you so much for conducting this session. We really appreciate it, and thank you all for attending. Hope you have a great Wednesday.
Thank you, guys.
Thank you.
Thank you all. See you later.
Thanks, everyone. Good luck.
Thank you, Katelyn. Katelyn, I have something for you.